The Alberta government has just released its official COVID-19 response review, and it calls for an immediate halt of the novel modified RNA COVID-19 vaccines. The Alberta government's newly but quietly released COVID-19 response review is scathing, and part of it calls for an immediate halt to the novel modified RNA COVID-19 injections, especially for children. Commissioned by Premier Danielle Smith, the report highlights significant gaps in the data used to authorize these vaccines and raises serious concerns about their safety and effectiveness. Key findings include alarming statistics from Pfizer's post-authorization trial, 1,223 deaths and 42,000 injuries, with a disproportionate number of affected individuals being those who are healthy and young, not at all at risk of COVID-19 complications. The review first began in 2022 when clinical lead for emergency medicine in central Alberta, Dr. Gary Davidson, was tasked with examining the data and governance surrounding the pandemic response. This included reviewing non-pharmaceutical interventions like masking and lockdowns, the modeling used to predict outcomes, and the role regulatory bodies played in the response. Experts like Jay Bhattacharya, Byron Bridle, and David Speaker contributed to the report. Dr. Davidson criticized the abandonment of Alberta's pandemic plan in favor of a more reactive, seemingly top-down decision-making, leading to unintended consequences like a surge in accidental deaths from overdoses and suicides, which he says have not returned to baseline levels. He calls for a return to a more localized, Alberta-specific approach. In terms of pharmaceutical interventions, the task force recommends halting the use of COVID-19 vaccines without full disclosure of their potential risks, ending their use in healthy children and teenagers, conducting further research into their effectiveness, establishing support for vaccine-injured individuals, and providing an opt-out mechanism from federal public health policy. In addition to that, they recommend a careful assessment of risks and benefits, transparency, and individual choice in decision-making for any future pandemic response vaccination initiative. The summary of the data used to authorize these injections, which fell squarely on Health Canada's shoulders, found that there were significant gaps identified and that these were never discussed. Whether or not a risk assessment was conducted is unknown. I have been probing Health Canada for this exact risk assessment in an attempt to determine that the benefit of these novel injections outweighed the risks for those under the age of 18 since they first began authorizing them for those age groups in May of 2021. The agency responded to one concerned Ontario doctor, Mark Benoit, that they were basing their decisions on feelings, not facts. Look at this. Health Canada's review of COVID-19 vaccines and therapeutic products is based on qualitative risk-benefit calculation. It would not be sufficiently accurate to quantitatively calculate risk based on our limited understanding of the virus and the disease. Wait, what? We have at least 16 months of quantitative data, and it shows that I want to bring you an uncensored version of this report, so if you'd like to see it in full, head on over to Rumble, where you can watch this in its entirety without the censorious YouTube community standards meddling in the way. Head on over to Rumble, and I'll see you there.